Welcome to Deuk Spine Institute, January 30, 2025. Our patient comes from Canada. He's been suffering with neck pain for years, and we figured out why he has years of neck pain. As a matter of fact, 10 years. He has two problems: facet joint pain, disc pain. We're going to fix both today. So the facets are hurting him. Whenever he twists his neck, he has stiffness, crepitus or crackling, and pain. The pain is really severe, and it's really, really bad around C4, C5, but it involves the C3, 4, 4, 5, 5, 6, 6, 7 facets on both sides. And you can see on the x-ray he's got arthritis in the facet joints. Okay, let's get started. If you have questions, feel free to ask me. In the meantime, while we're getting started here and getting down to the facets through the back of the neck, Henry, show the audience the 30 causes of neck pain. Shot?
Copy that.
I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see from the 30 causes of neck pain, the disc is the most common cause, but the facet is the second most common cause of neck pain. And number 3, 3-4 facet joint is our top target. Jordan has the arrow on it. You see that?
Yes, we do.
Now look at the waist of the bone, the lateral waist. See how it goes from the top to the bottom of the lateral mass? It kind of wastes in. Right where the tip of my probe is, that's where the first pain nerve lives. Okay, right there. And that's called the medial branch of the dorsal ramus. I got to get my probe perfect. Okay, right where the tip of the probe is, right there. That is exactly where the pain nerve is. Literally right there. It runs along the bone, shot. Okay, that's 2 medial. Shot. When I say shot, I'm asking, so see where the tip is? Put the arrow there. That is exactly the most perfect spot, right where the pain nerve lives. It wraps around the bone right there. I just felt it. I literally just cut it. And, you know, you've got to feel bone here, folks. If you're not feeling bone with the tip of the probe, then you're not in the right place. So it's very important before you do anything, you feel the bone. And I just felt it. I felt the pain nerve go. I'm going to move to the second one. Any questions, feel free to ask.
Yes.
Go ahead.
We have a question coming from LQ on Twitter.
Hello, LQ. Shot.
Asking if your meniscus was removed due to a sports injury and an x-ray shows a lot of arthritis in your knees in your mid-30s, painful knees, 5 out of 10 pain all the time, sometimes 10 out of 10.
Sure.
What would you recommend for treatment and diagnosis? Is an MRI needed?
Yeah, it's a great question. So the treatment I would recommend is what we do here at Deuk Spine. It's called the Deuk plasma rhizotomy. You're watching it right now. But instead of doing it on the neck for you, we would do it on your knee. We have to destroy 3 pain nerves, and that would take away all the pain in your knee that comes from the arthritis in the joint. The test that you need is an MRI, yes? And you need to set up a free MRI review with Dr. Patel. He's our sports medicine doctor. And you just do a regular MRI review on our website, deukspine.com. And Henry will put the link for you. And if you're a candidate based on your MRI and your complaints, your chief complaint, then Dr. Patel would recommend the Deuk plasma rhizotomy, which is going in and basically treating the pain by eliminating the pain nerves, but you get to keep your natural joint. You don't need a joint replacement. And that is, I believe, the future of arthritic joint care in America and the world. John? But it only works for certain types of knee pain. It doesn't work for all knee pain. It doesn't work for like patellar tendonitis. It will work for meniscus pain. It works for degenerative joint pain. It won't work for a Baker's cyst. And it won't work for pes anseranus, which is inflammation of a tendon called tendonitis of your quadriceps. So it really depends on the cause of your pain, but it works for degenerative joint disease pain. All right, we are making our way down the facets in his neck, and I am severing, cutting, destroying the pain nerves to those joints that are hurting him whenever he turns his neck. This surgery is done through a single 4mm cut. That's it, 4 millimeters. It's amazing. And all we do is put a Band-Aid when we're done, and he goes home, okay? But it is a painful surgery. I'm not going to lie to you. Patients complain of neck pain for a few weeks afterwards, like a burning in their neck. That's normal to have, like in the muscles, not on the skin. Generally in the muscles, shot. And it's a permanent fix to facet joint pain. So, Henry,
Yes,
let's
sir.
show the audience how facet joints can be so painful and how we treat them here at Deuk Spine.
Of course.
Shot.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We have just finished the right side Deuk plasma rhizotomy. We've basically severed, cut, destroyed the pain nerves to the facet joints that were causing his pain. Once he's healed up, he's not going to have any more of that pain in his neck with rotation. I'm very happy for him. He's suffered with pain for over 10 years. Shot. We're going to go off to the other side now. Show us the arthritis there, Jordan. Can you guys see the little white arrow? Yeah?
Yes, we do.
All right, go to the joint itself. Yeah, you see the joint. Now go to the one below and the one below. See the dark color, the dark lines?
Yes.
That is called sclerosis. Normally, bone doesn't have that appearance in the facets, but because there's arthritis and what we call some instability, the bones are grinding, causing pain. Shot. All right, so let's see, one more time. Hold on. Shot. So let's see, 2, 3, 4, we're over 5 again. That's probably a good spot. Go ahead and make it right there. We're going to make our incision. I think we have any questions from our audience?
We have a comment coming from Lanu on YouTube.
All right, we'll take Lanu's comment.
Saying, I have recommended one of my medical friends who has back pain to your service. There's a chance she will visit your facility this month because she was impressed and lives in Florida.
Thank you, Lanu. I appreciate it. You're starting your journey of healing people and helping them heal. Very thoughtful of you. I hope we can help her and figure out what's wrong and help her. All right. Shot. So we're going to do the left side now. I've got to make my way up to C3. C3 is a little bit further up the neck. Okay. And I like to do everything through one incision, if possible. Shot. In most patients, it is possible. Jordan, show us our target. Correct. Thank you, Jordan. Shot. All right, do we show the video on how we cure facet pain?
Yes, correct. We have.
All right, I'm right on the bone, which is nice. A little bit too medial. I need to be more lateral. Shot. Yep, I'm going to go a little bit higher. Shot. All right, that's pretty darn good right there. And I felt the nerve go, the pain nerve, I felt it cut. You can actually feel it with the probe. Shot. Want to go a little bit more lateral. Shot. Good. And so we've shown the video on how facet joints cause pain and how we fix it.
Correct.
All right. Well, since we're going to be treating his disc next, why don't we show how discs cause pain as well?
Of course. At this moment, no current questions.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We are done. Thank you for the countdown, Henry.
Of course.
Let's take the comment.
This is coming from, oh, and we just got a question. This comment coming from Perry on Facebook.
Hi, Perry. I'm going to show you guys in just a moment the incision that we made.
Perry said, I have had this done cervically and lumbar. Not by you guys, of course, but my cervical one caused so much pain that it took me 6 months to recover from it. My lumbar didn't help at all, but I've heard so many great stories of pain relief.
Yeah, I'm going to be honest with you. You did not have the Deuk laser, the Deuk plasma rhizotomy, unless you came here. You had a rhizotomy or RFA. It's not the same. Those procedures that you had, they don't work. This does work, and it works because we don't just put a skinny little pathetic needle down there and try to burn the nerve. We actually put a big wand and we cut the nerve. That's what makes it different. It's patented, so I don't know anybody else that could be doing it. They shouldn't be. But I pioneered the technique that you're seeing here, and it's only available here. So my advice, come here and get it done right. Get out of pain. I can't tell you how many hundreds and hundreds of people we've cured their pain with this procedure. Why? Because we do it the right way. We used to do the RFAs, the same procedure you have. We did them all the time. But then I had a talk with Dr. Patel, he's done 10,000 RFAs. I said, why do people keep coming back? He said, because the nerves grow back. And I said, the nerves shouldn't grow back. If you do it right, they won't grow back. As a neurosurgeon, I know how to cut nerves. I know how to protect nerves and I know how to cut them. So I decided to try something and cut the nerves my way, and guess what? It works. And we've been doing it now for about, 5 years almost. There it is. There's the incision. It's Band-Aid, 4 millimeters, one on each side. Put some pressure, a little pressure dressing. Done. We're going to bring you guys back shortly for the Deuk laser disc repair, because it's not just the facets causing his pain, it's his disc. He has one disc that's causing the pain as well, and that is his number 5-6. It's annular tear, disc bulge, and causing pain. So we're going to fix the disc next. That will be a separate stream. Any questions for me?
Yes, we have about 2 questions. This first one coming from Pawn Lust on YouTube, asking, have you ever had patients with a disc injury in the cervical also causing jaw pain when standing up a longer duration?
That's a great question. Thank you for asking. Yes, you can get jaw pain basically not from the disc itself, but secondary, because the disc is causing symptoms, and what happens is you're clenching your jaw. Now, most of the time, jaw pain is going to be TMJ, and you got to be checked for TMJ. That's pain right in front of your ear hole or inside your ear hole with your mandible where it articulates with the base of your skull. So check for TMJ, temporomandibular joint pain, and but you can get jaw pain from clenching your teeth from neck pain, sort of indirectly.
And then lastly from, forgive me for not pronouncing this correctly, but we're going to go with Reddy on YouTube.
Hi, Ray.
Asking, can we have a fellowship under you who is doing spine practice for international students?
Yes, you can have a fellowship under me. You just have to contact our office. I would recommend how do they contact the office, Henry? Phone?
Mainly phone, yeah.
Yeah, we have a 1-800-FIX-MY-BACK. You can call. I don't know if you're able to call. I don't have, what is that program, that app called?
Like VPN?
No, it's, what's the one everybody in Europe uses? I can't remember the name. Brandon may know. People use it to call each other. It's free.
WhatsApp?
WhatsApp. I don't have WhatsApp. I don't use WhatsApp. But yes, we would entertain a fellowship with a student who's international. And we're also looking for a research fellow who wants to help publish papers and do clinical research. So we offer a clinical research fellowship as well as a surgical fellowship. But, you know, I'm very particular about who I would allow to come here. And you have to be top of your class, you know, basically very, very serious and have the ability and aptitude and desire to do the best in the field for the patients. Basically, I would not consider a doctor who wasn't very serious with their commitment to medicine and patient care. So just make sure before you even apply that that's who you are. All right, thanks for joining us. We'll be back in 30 minutes, or 15 minutes actually, for the cervical Deuk laser disc repair on this patient from Canada with 10 years of neck pain. We just treated his facets. Next is the disc.